Education, abstinence, and parental involvement are vital in reducing the rate of teen pregnancy. Tears streaming rapidly, the new mother, unaware and unable to contain her emotions, freezes. He walks away, fleeing with her hopes, dreams, and desires. Her whole life is gone. Just like that, but another life will come. Teenage pregnancy can ruin a life, but at the same time bring more life. When teenagers tell their father-to-be that they are pregnant, normally the men walk away. The teenager gives up school and chances of getting a job. Teenage pregnancy affects every aspect of your life, good and bad. A lot of us parents take for granted that our child would never do this, with the peer pressure and everything around them in this day and time says different. I feel it is important for you to hear some statistics so you can understand how easy it would be that your teen daughter could get pregnant. And right here I have a chart of the teen pregnancy back in 2001, from 15 to 19 years old. That's the highest rating for teen pregnancy out of all the other ages. This was back in 2001. In 2010, the statistics were more than this. And this shows from it going up from 1950 to 2000, the rate is steadily increasing for pregnant moms, pregnant teenagers. The rate is now about 40 births per 1,000 females ages 15 to 19. U.S. teen births are still the highest among industrialized countries. Every 26 seconds, a United States teenager becomes pregnant. Every 56 seconds, another adolescent gives birth. And every hour, 56 children are born to a teenager. There are many teenagers in this world today who are having premarital sex and are not taking precautions. Everyone thinks this could not happen to me. This is not true. It can happen to anyone. If you are having sex for the first time, there is always an 85% chance that you will get pregnant if you do not use protection. Some forms of protection like birth control, condoms, wearing a patch weekly, or just getting a depot shot. By the age of 19, 1 in 4 black women and 1 in 7 white women are already mothers. 7% of young men become fathers while they are still teenagers. Nearly 1/4 of teens that has a baby have a second within 2 years of their first. These young parents are suddenly faced with huge responsibilities and confusing choices. It is not enough knowing statistics, but what are other complications that come along with teen pregnancy? Pregnancy puts a lot of physical demand on a woman's body. It is especially demanding on a teenager whose own body is still developing and growing. For this reason, teens run a higher than average risk of having serious complications with pregnancy and childbirth, such as premature or prolonged labor, anemia, and blood pressure. These risks are even greater for teens that are less than 15 years old. Teenagers often have poor eating habits, smoke, drink alcohol, and take drugs. This increases the risk that their baby will be born with health problems. A baby born to a teenage mother is more at risk than a baby born to an older mother. 9% of teenage girls have low birth weight babies under 5.5 pounds, compared to 7% of all mothers nationally. Low birth weight babies may have organs which are not developed. Sexually transmitted diseases are very real and are harmful to a teenager. By teenagers having sex at such a young age and uneducated, you can get STDs. By you having several sex partners or your mate having several sex partners, you can get STDs. By having unprotected sex, you can get STDs. Latex condoms are the only form of birth control that reduces your risk of getting an STD. Notice I said reduces. If that condom tears in any way and that person has an STD, that just increased your risk of getting it. STDs are very serious health problems. If left untreated, some STDs causes permanent damage, such as infertility and even death, like HIV. Treatment for STDs can be painful, some can be cured, and some can be treated. Others will have to take medications for the rest of your life. Now that we know some harms and lifelong problems of teenage pregnancy, let's talk about prevention. And before we talk about prevention, this is a rating of all the states. If you notice, Georgia, the state that we live in, is number 7 with the highest STD rating. So this just happens to be on gonorrhea, but there's several like gonorrhea, HPV, syphilis, chlamydia, all of these. And this is just one that Georgia ranks number 7 in. If you'll notice here, this is chlamydia. It starts at age 12 that they're picking up on teenage girls that already have STDs. And some of them are treatable, some of them are not. HPV is a virus. It'll stay in your system for the rest of your life. It'll be treated, but it'll flare back and you'll have it for the rest of your life. So you will have to constantly go to the doctor and keep getting treated for that. Abstinence is the 100% foolproof way to prevent pregnancy and STDs. Parents, we have to teach our kids at an early age what their options are. Take this time to completely be honest and upfront with them. Tell them what your beliefs are as a family and listen to every word they have to say. Parents, if you do not talk to your teenager or preteen, someone else will, and you would rather it come from you because you will do what is right and safe for your teenager. Whereas if someone else tells them, they can mislead or tell them something that you as a family do not stand for. Teenagers, you need to be honest with the person you are with. Let them know up front and be crystal clear as to what you want. Stand up for yourself. Don't let peer pressure interfere with what you believe or what you want to do. After that, if you still feel the need to have sex, go to your local health department. We will give you free condoms, free birth control, and educate you so you will be protected. If you are worried about your parents finding out, don't worry, because in the state of Georgia you are protected under the HIPAA law. That means anything that you go to the health department for, we cannot mention to your parents or anyone else without your consent. Parents, I know this does not seem fair to you as a parent, but at least if your teenager did not feel comfortable talking to you, they could go and get some protection and education free of charge. There is no reason any child in the state of Georgia should be having unprotected sex or become pregnant, because that is what your local health departments are there for, to prevent and protect the citizens of your local counties from STDs and unwanted pregnancies. Parents, I hope this has opened another door and source for you to use to help protect your family. If you have a hard time getting out the words to tell your teenager, go to your local health department, and we have brochures, pictures, and even our nurses will help educate your teenager. I challenge you, parents and teenagers, to be the voice of your teenagers and friends to get the word out that there is help for unprotected sex and unwanted pregnancies. If you do not feel comfortable in coming in, give us a call and the nurse will speak with you over the phone until she feels that you are more at ease with the situation that you have at that time. Being educated, being abstinent, and having parental involvement, this is vital for having a drop in the teen pregnancy rate. So parents, from here on out, it is our job to be active in our teenagers' life. Talk to them, be sincere and listen. Teenagers, take care of your body. Be honest with your parents and tell your boyfriend that you want to remain abstinent until marriage.